The Mississippi Delta is the most unique regions in the state of Mississippi. It has the largest concentration of African Americans. It has the highest poverty rates and very embedded in a long-standing history of racism that manifests in unequal resources along education opportunities, employment opportunities, housing, and access to health care. Indianola is particularly interesting because the school district is under conservatorship, and it's one of the poorest performing school districts in the state of Mississippi. I work with students at Gentry High School, Indianola primarily, and we do creative and fun work on the Affordable Care Act, and we talk about a host of issues related to health care and access to health care. We really just try to get them thinking critically about the way in which we engage in the healthcare process.
What is healthy? What kind of activities?
Megan has been coming in and bringing this to the students. She's been bringing what's going on a national scale to them, and she's been presenting it in a way that is meaningful because it relates to their lives, because everyone knows someone who's been sick or someone who's had a problem with health insurance, especially given all the health problems that really affect areas like this.
I hope that every time I'm in that classroom that I am encouraging someone that they can do and be all that they want to do and be in this world.
The Delta needs permanent organizations. It needs permanent people that want to live here and that want to stay here for the long term, and invest in people so that they can invest back in them, and that real dialogue and collaboration can be going on.
My hope is that we will be able to establish ourselves as a viable community partner, that we will be able to use our community organizing and advocacy skills as an amazing tool for the community to use and implement in the quest for justice and equality in the Delta.
There are a lot of issues plaguing education in the Delta. One that has been the most prominent is children with disabilities. Because we live in an area such as the Delta, our resources aren't always there. And so most of our children who have emotional disabilities are left with the mental health centers here, which a lot of times are deficient. If a child has a disability that has not been identified and has not been recognized by the school district, oftentimes they're the ones who get lots of suspensions, out-of-school suspensions, and we know that any child who's suspended is more likely to repeat the grade, and any child who repeats the grade is more likely to be a dropout. Well, Miss Ura Jones called me about some issues she was having with her daughter in the Clarksdale School District. Imani Strong, who is her granddaughter, had been disciplined more than 15 times. She had only been in the school since November of 2011, and she had received suspensions, in-school suspensions, out-of-school suspensions. She had been paddled various times.
When I got suspended, it made me feel mad sometimes because half of the time I didn't do anything, and I'm missing out on schoolwork and stuff, homework, tests.
And her grandmother had gotten to a point where she had just had enough.
I made numerous of calls that wounded up, made dead ends. But I finally got to the Mississippi Center for Justice.
Once I went to Clarksdale to meet with both Miss Jones and her granddaughter, I learned that she had been a part of a special ed program in Connecticut where she come from. I asked Miss Jones, had she provided that information to the Clarksdale School District. She said at the time of registration, she attempted to give them that information, but they refused it. Once I contacted the school district, and of course I immediately provided them a copy of the program that she was under in Connecticut, as well as a doctor's report that Miss Jones provided me. outlining what her disability was, they immediately gave the child services and scheduled a meeting with both the parent and the child. Whereas Ms. Jones was unable, I guess, to communicate that to the school district, they were really ready, willing, and able to accept it from me. And since that time, she has had a much smoother road.
I feel like I'm on the road to recoup. I feel really excellent, and the teachers has been wonderful.
Every child deserves the right to go to a quality school, to be taught by quality teachers, to have quality supplies, and to go attend a quality facility. And that's why this is a civil rights issue.
Cleveland, Mississippi is in the Mississippi Delta, which is the 2nd congressional district, and we are also the poorest district. We're 2 hours south of Memphis, Tennessee, and 2 hours north of Jackson, Mississippi. We are in the heart of the Delta, and we still have strong discrimination issues across the board.
Here in the Delta is the 2nd highest rate of HIV in the state of Mississippi. Mississippi itself is the 6th highest rate of HIV in the entire country. And the Delta is especially hard hit because not only do you have HIV, but there are many barriers that can come with it. The stigma against having HIV is extremely strong. People think the only people who have HIV are ones who deserve it.
A lot of individuals that are positive are not able to work because if it's known or suspected that you are positive, agencies don't want you working for them. And when individuals do not have employment, they don't have insurance. Then when we start looking at housing, because when quote, word on the street says you're positive and individuals have that authority, it's housing discrimination. That's the bottom line. We don't want your kind staying here, things of that nature. And especially in the Mississippi Delta, a lot of our housing situations are not to the best in the first place.
The Center for Justice has received numerous complaints of dental providers, even doctors themselves, turning HIV positive people away at the door simply because they don't want to be associated with someone who has HIV. So at the end of the day, you have HIV, racism, homophobia, and fear, and that's the perfect storm that creates such a huge civil rights issue in this context. The Medical Legal Partnership is a model that puts an attorney on site at the doctor's office to make sure that doctors and lawyers can work together to provide comprehensive health-related services to patients.
It will eliminate some of the illegal practices that have been taking place with housing and rights, employment.
If we can open the door to better medical care in Mississippi, that will save the lives of thousands of people.
To have the Center for Justice here in the Delta means we have help. Having a center here is what we need, what we've been wanting, and we would like more of it.